Hello everyone and welcome back to Healthy Tip Thursdays. My name is Dr. Christina Christoforou and I'm the founder and owner of the Holistics Naturopathic Health Clinic. Today we're going to talk about seasonal affective disorder. Quite appropriate now as we're entering the winter season, and for many of us Canadians, especially living in Canada, and our winters being quite harsh and quite dark outside, a lot of us do tend to suffer from seasonal affective disorder. One of the big reasons why is that lack of sun exposure. So let's talk about our usual stuff that we talk about. What can we do to prevent seasonal affective disorder from happening? What can we do to treat it? And what are potential root causes of seasonal affective disorder? So prevention. Well, we do know that vitamin D is very important. We do get vitamin D when we're out in the sun, especially in the summertime. But of course, in the winter, we don't get that vitamin D. So what's really important in order to prevent seasonal affective disorder from coming on is to make sure that you're sustaining your vitamin D levels. So one of the things you can do is definitely get tested by the end of summer to find out what your baseline of vitamin D is. Of course, your naturopathic doctor can do that for you. And depending on where your levels are at, then you can start supplementing through the winter season. Low levels of vitamin D has been linked to depression or seasonal affective disorder. So typically during the winter season, your dose could be anywhere from 2,000 IUs to 4,000 IUs of vitamin D. So making sure you're getting that vitamin D during the winter season will prevent seasonal affective disorder. 2, exercise. How important is that? Research shows that even doing 20 minutes of exercise, whether it's a stationary bicycle or even an elliptical, that it helps increase your serotonin levels. I'm sure you've all heard of serotonin. Serotonin is a neurotransmitter that's important when it comes to elevating mood. So we want to make sure those serotonin levels are elevated, especially during those winter months. Third, well, what about diet? Of course, always important. So what foods can we eat to help sustain those serotonin levels and to keep you feeling happy? So one of the big things is to look at foods that actually have tryptophan in it. So I mentioned serotonin, now I'm mentioning tryptophan. So tryptophan is actually the precursor to serotonin. And serotonin, you cannot find it in food. So we have to look at the precursor foods, and that's tryptophan. So what foods are high in tryptophan? Well, the big one, of course, is turkey, chicken being another one. Believe it or not, green leafy vegetables such as spinach, so definitely increase that. Tryptophan is also found in eggs, and you can also find it in seeds. The other thing you can do is increasing your omega-3s. So we talked about omega-3s before for inflammation or having those anti-inflammatory properties, where omega-3s also help when it comes to elevating mood. So increasing those omega-3 foods. So things like salmon, for instance, have high amounts of those omega-3s. We talked about nuts before. So types of nuts that you can look at are things like almonds or even walnuts. Okay, so you're going to do that. You're going to try and prevent it. But what if those winter months do come in and you're starting to feel low? Well, one of the best things you can do, and it's definitely worthwhile purchasing, is buying one of those face light therapies. Light therapy has been proven to really help with seasonal affective disorder. You're getting that light exposure like you're out in the sun. So doing that 20 minutes a day in the morning can really help giving you that light and keeping you feeling happy. So light therapy is one of the things you can do. Second, well, we talked about those essential oils. So lavender, again, has those calming effects, and it can also help increase and elevate that mood. So using lavender essential oil can also be really helpful. Another big one is actually called bergamot. Bergamot has more of a citrus smell. It has been linked more with anxiety, but anxiety and depression tend to go together. So that's another one. So what's good to have in your cupboard drawer? Like I always mention, lavender and bergamot are one of the big ones. Acupressure is another thing that can really help. So one of the big acupressure points that can help with depression is one of the big ones is called the yin tang, which you put pressure right over here. So if you put pressure right there, maybe even close your eyes and just do some deep breathing for maybe about 5 minutes, that can really help decrease that depression. Another big point is actually called pericardium 6. That one is on your wrist. I can show you. Okay, so usually we do 3 fingers down, and it's just about over here, right in the middle between your two tendons. So if you apply pressure right over there, again for about 5 minutes, yes, it helps with anxiety, but it can also help with depression. Okay, so the light therapy, acupressure points that I just showed you, and of course using some essential oils like lavender and the other one bergamot. But sometimes that may not be enough. We need to take a look and see what is the root cause of your seasonal affective disorder or your depression. So again, it might be important to get tested for certain nutritional deficiencies. The big one I've mentioned, yes, vitamin D, but sometimes deficiency in B12 or B6 can be a contributing factor. Another thing is hormonal imbalances. So if your hormones are imbalanced, then that could contribute to your mood being low. So again, talking to your naturopathic doctor and maybe getting tested. One of the big tests we like to do is the Dutch test. Another thing we like to do is the organic acid test. That one looks at neurotransmitters as well. So talk to your naturopathic doctor and see if you are deficient in any of those vitamins or if you do have any hormonal imbalances. So I hope you found it helpful.